Hi, this is Robert Rickover. I'm an Alexander Technique teacher in Lincoln, Nebraska, and I teach in Toronto, Canada. My guest today is Eileen Troberman, who is an Alexander Technique teacher in the San Diego area. We've been doing a series of videos where Eileen's been actually instructing me. My situation is a few months ago, I had neck surgery and a fusion between C3 and T2. So that, of course, affects a lot of stuff up in the head, neck, upper torso area. And today we're going to explore a little pattern that I evidently have, which is a little pushing forward at the top of my spine, which of course not a great idea, and how I might not do that. Thank you. Welcome, Eileen.
Thank you, Robert. So, what I'd like you to do to start with is just to stand up and then just to walk over to where whatever those are, the walking sticks over there in the vase
Mm-hmm.
on the floor,
Mm-hmm.
um, and back. So just go ahead and stand up and walk over
Just
there.
walk over there and come back
Yeah,
and
yeah,
okay, all
and
right.
yeah.
Okay, here I am.
Well, good. Good to see you back. Um,
Yeah, I made it back okay.
so there's just this little habit that, in a way we all are tempted to do, like we talked about before, is where our attention goes, our head kind of
Oh, I
goes.
want to get a better look. Yeah, that
Yeah,
kind of thing.
yeah.
Yep.
Or
Mm-hmm.
we're heading this way, and it's
Yep. A
we
little
do that.
pushing forward.
Yeah, because we have a lot of sort of attention up here, not necessarily a certain kind, but to where, oh yeah, okay, this is me up here thinking and I'm going this way. And
Mm-hmm.
so it ends up just doing that little bit of we'll bring out Fred here, that little bit of a forward
Yeah,
like this.
exactly.
So
Yeah.
both the
Mm-hmm.
forward at the top with C1 and 2, both a forward that way over C3, and then also a little forward from T, is it T2? I forget, or T3. You've got,
T2. Yeah.
yeah, from your thoracic area, a little forward like this
Mm-hmm.
too. Like it's like,
Right
oh,
in through here.
yeah, yeah. So really, it's almost like, oh, okay, I'm going over there.
Mm-hmm.
Yeah. So it's really the Alexander technique, but we're going to call this in honor of the late, great Kobe Bryant, the Kobe Bryant method. So,
Sure, why not?
yes. So here I have a picture of Kobe Bryant. And the really top athletes, the ones that are not just pro athletes, but the ones that are just so incredibly naturally talented,
Mm-hmm.
just have that freedom in the upper couple of vertebrae in relation to their head. And we
Mm-hmm.
have that natural curve there that goes a little back and up at the top. We're going to look at that in a moment on the big skeleton.
Mm-hmm.
But you can kind of see there's a little like backing up at the top of his neck.
Mm-hmm.
So right
Mm-hmm.
about, if we're looking like right about in
Yep.
here, you can see it
Yep.
goes, yeah. So if we look at it on this guy here, see, there we go. If we look at it here, you see this all right?
Yep.
Yeah. So you can see there's a nice curve forward in our neck, just like we have this curve here and curve here and curve here.
Mm-hmm.
It's a nice curve forward, and then the upper couple of vertebrae start slanting a little back and up.
Mhm.
And so if I lift his head up a little bit, you can even see the angle of that atlas, that top vertebra,
Mhm.
slanting a little bit, almost like the back's lower than the front.
Right.
Yeah, so it starts curving a little bit, just a little bit back and
Yep.
up.
Mhm.
And so what that does is it lets our head go a little bit, really lets our head go forward and up in Alexander terms, but because
Mhm.
it's our neck, top of our spine going a little back and up, it really takes away this tendency to pull this forward. So I'm
Mhm.
going to show you uh, one more part of the Kobe Bryant method. So I'm
Yeah.
kind of joking, but I, thought I would honor him with this.
Sure.
Um, just here, see, I'm gonna flick it as I hold it up because it's a very short little video. I don't even know that it's a minute long, and
Mhm.
there's no sound. But you see, on a talk show, but you can see the freedom he has up here. And the thing is, you have that freedom up there. That's not that's not limited.
Mhm.
And you can really use that and play around with it, but we tend to use it more forward
Mhm.
and then
Mhm.
sort of forward and maybe back to neutral. We don't even play around with this kind of back thing. So you'll see how much that all moves on him in a moment. So I'm gonna
Mhm.
uh, let's see, I think I will do this where I swipe him over and whoops, there we go.
Right.
See all that freedom? First you
Yeah.
see the side to
Yeah.
side also. And
Yeah.
then there's going to be in a moment at the very end of this, you'll see, he has something he feels really strongly about whatever he's saying. And then he has this funny expression at the very end of the video where you really see the flexibility of going back and up on the top in a moment here. There it is.
Yeah. Right.
Yeah. Yeah.
And that's where a lot of people would push forward,
Yes. Yeah.
right at that point, to emphasize, as an attempt to emphasize something.
Yeah, and with
Yeah.
that little bit of freedom going that way, the whole front of
Mhm.
you can lengthen, the back
Yeah.
too. But it's not just here. It actually really helps bring along the whole front of you. So it takes away a
Sure.
little bit of a forward and down of your whole
Mhm.
body when you're walking. So, yeah, because you have the freedom to do this, do you, in your system if you just did?
Sure.
Yeah, can you
Mhm.
do just a moment of this? Yeah, there you go. So your head tips
Like
down a
that.
little bit as it goes back. Yeah, your head tips forward as yeah.
Yeah.
So your head. So if you were looking down at the
Mhm.
keyboard or something, yeah, yeah, there you
Mhm.
go. So with that, and then there's that little freedom. Yes, because that's part of it. That tip we call it forward and up in Alexander. We're used to talking
Mhm.
about it like that, but it's not forward like that. It's really just
Mhm.
that little rotation, the absence of that pull down, like on Fred here. If again I do that little pull forward here, and I let this go, you'll see how his head here will
Mhm.
go in a way we could call it forward and up as his spine
Mhm.
goes back and up just by letting it go. So that little rotation that is, yeah, there you go. Yeah, so there's really a softening even under here. And yes, that
So that's just directing that area back and up, basically.
yeah, and playing with the freedom there. Just
Right.
getting that to be part of your repertoire, your expression. So let's try that with walking. Let's give it
Okay.
a try. Yeah, or even
So,
standing up.
all right. We'll
Yeah,
stand up and I'll walk back there and I'll walk back here. So that's
and just
quite a
like
bit of,
a playful direction, really.
yeah,
It's not a
yeah. No big
nothing
deal,
to
but
and yeah.
mhm.
So just even as you're walking, if you were playing around with that direction of that going, yes, there you go. And then even as you turn, play around with that direction again. Just like
Mhm.
you just almost not like a gesture, but
Mhm.
just even as you sit, you can play around. Yes, there you go. Great. Yeah, it's just a playful thing. And it's kind of the reason I had you look down at the keyboard is
Mhm.
because part of that, because if I'm doing this, forward here, as I let that go, and this comes back and up, see how it lets your head really
Mm-hmm.
have that balance on its center
Mm-hmm.
of gravity here, that tips and this is really, I'm saying here, but it's your whole body, but it really is like, wow, I can play around with that. You can have it as part of your
Mm-hmm.
like, oh, gesture or expression or yeah.
Mm-hmm.
So that in walking, it's really the whole of you that goes forward. But it's so easy to think, oh, no, no, I'm interested in that. And then we think, this is where I live up here. And,
Mm-hmm.
even though we
Mm-hmm.
have the rest of our body, there's so much sensory and other information here. Yeah, yeah, yeah. And that just that little bit to play around with that freedom because you've got that.
Mm-hmm.
And the time we were doing the one where you had that easy side to side, you've got that too, just like Kobe was doing there with that little freedom. So actually the little side to side, I mean, that's fine, but that's not that's more than on the top vertebra. So we were just talking about
It's
that tiny
everything,
bit.
the whole torso.
That's the whole torso, that's one thing, but you can just do a tiny bit that's just your head. Just
Mm-hmm.
less than that. Because if it's just going to be between the first and second vertebra, it's not going to be a lot of movement. There's not a lot of
Mm-hmm.
degrees, but a tiny bit right up there.
Mm-hmm.
Yeah, just like you're scanning the screen side to side as you let the top of your spine go a little back and up so your head can tip, then you have that little swivel that's just up there. And even when we did the thing of turning and including your whole body, that little swivel slightly leads it. Yeah, and then as you're turning, Robert, that as you're turning, can you think of that little bit of backing up in the upper part of your spine, the upper couple of vertebrae as your head tips
Mm-hmm.
forward? Yes. Yeah, so as you're turning, so you don't reach with
Mm-hmm.
this, because it's going to be
Mm-hmm.
tempting to reach with this.
Right.
You're limited on this, so it's easy to reach here or to reach with tipping this. So the idea is this goes a little back and up even as you
Mm-hmm.
swivel and turn. And that backing up isn't anything where you're going like, way
No.
back. It's
Yeah.
just actually releasing it. But we're
Right.
not used to that direction.
Right.
Yeah, yeah. So that's the thing I wanted to help you with it.
Okay. So we end it here.
Okay.
All right.